Hey everyone, thank you so much for tuning in to the Keep Birth Sacred podcast, where we honor the sacredness of the motherhood journey. In this space, we're changing the way women transition into motherhood, one sacred moment at a time. This is a place of advocacy, community, education, and healing. Here, we believe that birth and everything that surrounds it is sacred. Sit back, relax, and join us as we journey together. This is your sacred space to learn, to heal, and to connect. We are so glad you're here. And remember, every mother and every child deserves a sacred beginning. Hey everybody, thank you so much for tuning into another episode of the Keep Birth Sacred podcast. Today, I'm here with my friend Michelle. Hi, Michelle.
Hello, Becca.
Welcome. I'm so glad to have this conversation with you today. As always, we'll start off the episode just kind of talking about how Michelle and I know each other, and then we'll dive into her background and some of the things that she's going to be sharing today. So, do you remember when we first met or how we met?
I do. It was a long time ago, but I do remember.
Can you believe Arlen is going to be 10 in a few months?
I can't. No, I just still picture him as little.
I know. So I can't remember who recommended you to me, but just for the listeners, I was pregnant with my son 11 years ago, which is just like crazy to think about. And as I was on my own birth journey trying to figure things out, somebody recommended you. And I mean, we lived like, what is it? Like 2 miles.
Not even.
Yeah, from your office, and I started seeing you for prenatal chiropractic care, which was like bizarre to everybody around me. And I think you're the only one. Can you explain? Maybe we'll start here. Can you explain? I remember when we talked, you know, there's things that chiropractors can do and different things that you can be, you know, I don't know if it's certified necessarily or, you know, what it is, but I remember just being like very clear. My midwife was very clear about like, make sure you see somebody who has experience with pregnant women. So can you explain some of that, like what that looks like?
Yes. So I got my certification with the ICPA, which is the International Pediatric Chiropractic Association. And they do what is called a Webster certification. And it is, according to their website, the Webster technique is a specific assessment and adjustment for all weight-bearing individuals and is utilized to enhance neurobiomechanics in that individual. So they train all chiropractors in Webster, but it is also used for pregnant women. It is a specific adjustment of the sacrum, but they also have some other things that can go with the pregnancy. We do some things with the round ligament and the sacrotuberous ligament, which allow for the pelvis to be in better alignment. So really, if you're pregnant, you should be seeing a doctor that is Webster certified. Anybody can treat a pregnant woman, but you know, if you have that Webster certified doctor, it's definitely more beneficial.
Well, and to just kind of like back up a little bit, because some listeners might be like, okay, number one, I have never even thought about going to a chiropractor myself, let alone when I'm pregnant for the maybe first time or whatever. So can we talk about, and I know you have some things that we want to get to today, but can you talk about some of the overall like reasons or benefits why just an average person should be seeing a chiropractor regularly? And you know, maybe, I don't know, I'm sure that you've heard all of it as far as like all of the obstacles, you know, or objections people would have to chiropractic care.
So there's various reasons and benefits of chiropractic care. Most people, the main reason they come to see a chiropractor is pain. You know, and a lot of pregnant women, that's their reason for coming too, is because they're having lower back pain due to, you know, the structural differences in their body. So that is a benefit to chiropractic, that, you know, we are able to alleviate, you know, some spinal pain that you may be having if you're a regular patient or a pregnant patient. But what I also see in practice, you know, we talk more about the brain. the brain connects to your spinal cord, which then, off of the spinal cord goes all the nerves that control your entire body. So if there is a misalignment somewhere in your spine, that connection between the brain and the rest of your body is going to be a little bit diminished. So when you get an adjustment, it can actually help that connection where the brain and the body can talk better.
Interesting. And I don't know why I want to just jump to, because I know I'm going to be all over the place, but can you talk a little more on that when it comes to the baby too?
Absolutely.
Like specifically right after, right after they're born, which is also just crazy, because I didn't know that this was a thing. I didn't know, and just sharing parts of my story to be relatable, I guess, but I had never seen a chiropractor before being pregnant. And then when you were like, oh yeah, and I can adjust the babies too. I'm like, why did this not even occur? Why did this not even occur to me? But I mean, it makes so much sense now. So can we talk about that too?
Absolutely. Babies are my favorite. That's what I say. I keep saying my retirement plan is just to see babies. So one thing that stuck with me when I actually have my pediatric certification as well through the ICPA. When I was taking the classes for that, one of the instructors said something that just really stuck with me. And he said, what mom goes through with their pelvis, baby goes through with its head. And you've had 2 children, you know what it's like and what you feel. And that really hit me. I'm like, oh my goodness, that is a lot of pressure, a lot of, just it's so much on that baby. So a lot of times they can have a subluxation or a misalignment in their, spine somewhere. Usually we see it a lot in the occiput or in the atlas, which is your first cervical vertebra up at the top of your neck. But a lot of times there are misalignments and subluxations in that area due to the birth process itself.
So, thank you for explaining that, because I can sense that, and maybe part of my point of wanting to do this podcast is to just, not necessarily cause controversy, but to give people information to things, to normalize all of these different options that we have through, even all the way back to conception, and health before you even are thinking about conceiving a baby, all the way through pregnancy, labor and delivery, postpartum, and then, our children. And I just think I think chiropractic care, and I'm not in it, I'm not in it like you are, but can you talk about some of the taboo things, I guess, has anybody ever come to you and said, I don't know, just some total thing that's just not true?
I have
heard about it that's this is absurd. This is not true at all.
There's so many out there, unfortunately, but, and as with anything, there is a risk, even if you took vitamin C, there's a reaction to everything that happens. It could be good, it could be bad, but the risks are very, very, very minimal. But I've had, a lot of people don't understand why you would even see a baby or, a child or anything like that, because they're more pain focused. They don't have pain. Well, how do we know they don't have pain? Because they can't tell us yet. But I have heard, that doctor said you could paralyze my baby. If you've actually ever seen an adjustment on an infant, it is nothing that's done on an adult. So the chances of that happening are, pretty much non-existent. I don't think there's ever been a case once that's happened. So everything is, it's so gentle and so easy for the baby. They absolutely love it. Yeah. But I have heard that. I can't even remember some of the other ones, but that was the big one for me. I'm like, your baby's not going to get paralyzed. So yeah.
I think a lot of it's fear. Just like everything else. Even with me marketing, needing some guests for this podcast, a lot of people are like, Becca, I didn't have a home birth, but I know this one friend of mine who did. She might want to share her story. And I'm like, to be clear, this is not a home birth podcast. This is not a home birth podcast. This is not a, just total like anti-medicine. That's not what it is at all. It's trying to just expose these things to a broader group in a way that's just easy to understand. I feel like there's so much information out there that overcomplicates it. And I think this is like kind of leading into my next question based off of what you said, which is a good point. There's chiropractic care for, I guess I'll call it like preventative maintenance, and then for, reacting to pain or something. I'm curious if do you see a lot of people like me who never saw a chiropractor and then is like pregnant and coming in to see you or has some kind of pain? Like what percentage of your clientele are people who come in for you to fix something after they didn't believe in you this whole time?
There's more of a high percentage of people that come in for a problem. It's definitely, and the ones who have like seen me, that are coming in for preventative maintenance, they are usually coming because they saw somebody else and they just get it. They understand it. They know how good it makes them feel. So, but really there has to be some education at some point for them to understand, because, the stigma out there is chiropractic is just for back pain. So, but there's so much more to it. And that's where, one-on-one with the, individual, you can talk to him and explain to him the whole, aspect of what we can help with besides just the pain.
Yeah. And before we get to your notes, because I don't want to be on a total tangent this whole time, I will say personally, I don't know if you remember when I started seeing you in my pregnancies. I would say Arlen was probably later, but then I would imagine with Eva, I saw you the whole way through. And I never really experienced I don't know if I would even say that I experienced pain. And I would like to think that it's a testament to me keeping up with you through that time, and it's just interesting because, sometimes it's very easy to say like, oh, well, you were one of those girls that just really loved being pregnant, because I did love being pregnant. But I also saw you. I mean, sometimes I think I was in your office like 3 times a week. You know what I mean? If I just started feeling like I would say, everybody who's pregnant probably can say they felt uncomfortable, but to get to the point that it was this like devastating, pain or something, I don't know that I can relate. And like I said, I would like to think it's because of that preventative care. But then also, you taught me so many different things too, and I got turned on to so many other different things between whether it was you or my midwives or whatever, that I think really made the difference between, whether it was like, I don't know, I'm trying to think because I'm so far removed. I'm going to have to get my head like back in this space, but whether it was, different supplements or, you mentioned vitamin C, or just like walking outside barefoot, avoiding certain categories of foods at certain times. And then once the kids were here, I can't tell you how many times I recall them having like GI type things. All little babies, I think, go through that as you're determining what they're sensitive to or whatever. And I mean, guys, I would take my kids in there to see you. And I just remember I don't even know if we would make it home in like full diaper, like explosion.
I've had it happen on the table too with kids before too.
So, and I mean, I know it's just a couple of things, but I do want to get into, I know you're very research. I know you spend a ton of time on continuing education and everything like that. And you've prepared a few things that you definitely want to talk about. So we'd already mentioned pain when it comes to, pregnant women coming to see you. Most of the time it's because of something that's a nuisance, a problem. Was there anything more that you wanted to share about that topic?
Yes, there was actually one study that was done. And unfortunately with chiropractic, studies are limited because we're all in practice. There's not a lot of people out there doing research because, we went and got a degree so we could go help people and adjust them. So unfortunately, there's not a lot of research, and we definitely need a lot more. And there is, some coming down the pipe here, and hopefully we'll get more. But I did find one study that it included 115 pregnant patients with lower back pain, and 52% of the patients improved after 1 week of care. 70% improved by 1 month. 85% improved by 3 months. 90% by 6 months. And 88% at a year. So that shows that, chiropractic care can definitely be beneficial for pain. So those are really good numbers. And again, we did talk about risk. And all of the studies that were done on the risk of chiropractic care showed that there is no risk as opposed to any other treatment that they would be getting done. So whether it be PT or a massage or, something like that, there's no difference in risk between chiropractic and any other service that somebody might have due to pain.
Yeah, that's interesting. And I think I also would like you to mention, so, obviously if you're listening and if you've been pregnant experiencing these different discomforts, this lower back pain and stuff, or if you've, had your baby, if you've labored before, you know what this feels like. And can you talk about the idea of having a chiropractor available during your actual laboring time? Because I remember that even all those weeks seeing you, you're like, hey, if you kind of get in a jam, I don't really know what you said, basically that, if you kind of get stuck, if you get in a jam, whatever, I'm here, I can come and adjust you during this birthing process, while you are having your baby. And still then I'm blown away because I'm that would be amazing. I don't think I did need you. I can't remember.
No.
You came the next day.
So unfortunately with that, as chiropractors, we don't have hospital privileges, and most people are, delivering their babies in the hospital. I have had people come while they're in labor and then go to the hospital. Because it definitely, the more aligned your pelvis is, the better off you're going to be is to have a normal vaginal delivery. But if you were having a home birth, that is something that we could do. But unfortunately, we don't have any hospital privileges. I think it would be awesome if, we could get some chiropractors in the hospital to help mom through labor and delivery.
Yeah. And I'm excited to start. I have some other people lined up, and I'm excited to get my head back in the game and wrap my head around current statistics. I'm sure a lot has changed in the past 10 years. And I think those numbers for home births are increasing just from, I would bet, just based off of talking about this with people, and especially after COVID.
Right.
I feel like there were a lot of people who were like, well, maybe now's the time. And that's a whole other conversation that we will have a few guests, talk about, because there's many things to be aware of if you're going to have a home birth. As far as having a chiropractor, just not forgetting that the care doesn't end. The care never has to end. It's before, it's during, it's literally during your labor if you need it, and if you can have it, and then after, and even into your children, which is super cool. And my kids, actually, Eva just asked the other day, when are we going to see Dr. Michelle? I'm like, I know, we need to schedule with you. So what was one of the other things that you wanted to talk about today?
So one really good thing that there's been a little bit of studies on, but again, not a lot, unfortunately, was how the chiropractic adjustment will help the pelvic floor muscles. They're huge in pregnancy and delivery. They play an active role in the actual childbirth, and you have to be able to relax and contract those muscles. When you have a contraction, they contract and then they relax, and that allows the baby to move through the birth canal. And this study showed, that using ultrasound imagery to see if a chiropractic adjustment would affect the pelvic floor muscles, specifically the levator hiatal area, the study found that adjusting the pregnant women appeared to relax the pelvic floor muscles at rest. Now, they did use a control group as well, which was very fascinating. There was no difference in the control group. But the pregnant women, their pelvic floor muscles relaxed, but the control group didn't. But the interesting part about the control group is it was all made up of chiropractic students. So they were getting adjusted regularly because they were in chiropractic school. And they had found that their muscles, their pelvic floor muscles, were at an elite level, like what you would see in athletes. So that was very fascinating. And hopefully they will be doing some more research to see if getting the adjustment actually helps contribute to that function of the pelvic floor muscles, because that can help us, after birth, as well, because we need strong pelvic floor muscles after delivery because everything changes, as most of us know.
Yeah. Well, and let's talk
Experience.
about that. Let's talk about that too for people who, are maybe listening and they're like, I had a cesarean section or I want a cesarean section. Can you talk about the benefits of, and I know you know the answers to this, but this is kind of like a tangent, but the benefits of a vaginal birth for for both the mom and the baby, like why we would want to do that.
Yeah, so I actually am one of those people that I've experienced both. I have two beautiful boys, and my oldest is going to be 21 this year, and I had a C-section with him. I got certified with the Webster technique when I was 8 months pregnant with him. I didn't know anything about it. So I was not getting adjusted with the Webster technique. I was getting adjusted, but not as regularly as I should have been. And just some issues came up, and I labored for 26 hours and ended up, his heart rate dropped, and they more or less forced me to do a C-section. He, after birth, had a few issues. He wanted to always be in an extension position. It was more of that, his nervous system was overloaded a little bit because the intervention of a C-section, it's traumatic on everybody. It's traumatic on mom. At least for me, it was traumatic. I guess if it's something that's scheduled and it's what you want, then it's not going to be as traumatic for mom. But they're going to cut mom open. They're going to pull the baby out because it's not supposed to be, that's not the way it's supposed to happen. So when they're pulling that baby out, there can be a lot of stress on the head and neck as well. So that is a concern. He actually also had a lot of skin issues when he was younger, because when a baby passes through the birth canal, they get their first dose of probiotics through mom's vaginal flora. So that is super important. My second one that I did a VBAC, vaginal birth after C-section, had the most perfect skin, and I really think that was a big part of it. And the labor and delivery for him was just, I was the crazy person that said, I want to have another kid just to go through labor and delivery again. I got adjusted, up to the moment that I delivered him. I think I always went on Wednesdays, and I went into labor the next day on Thursday, and it was seriously the perfect, labor and delivery for me. So I personally have experienced both sides, and, my second did not, he slept like an angel. My first was up a lot through the night. So I just think their nervous system responds a lot better from my personal experience when they have a vaginal delivery versus a C-section. And the bacterial, the flora, the good probiotics are really important too. So, and then there's some other things like with reflexes. There's a reflex where they're kicking off and, extending back to actually come through. Those C-section babies never have that reflex. And that extension that was my son was in was that was part of that reflex.
Well, and I'll say something that I feel like this project's going to require me and every guest to be, a little bold in what we're saying and really trying to not have any judgment. But when you think about the way that we're created and the way that things were supposed to be and the way that birth happened for so long before the past, couple hundred years, it's wild. And we also have very similar faith, and belief systems there. So it's just so wild how distracted we can get and how far removed we can get from how things should be. Now, with that said, while I'm so grateful for all of the medical interventions that we have in the hospitals and I mean, let's just face it, like we have clean water, we have educated people, we have hospitals everywhere, all the things. I think that a lot of the times and this is in my experience and with the women that I've talked to, it's like, you go in more blind than you think you are, and you're putting your faith and trust in care providers that you want to believe have your best interest in mind, but like they really don't. They don't. It's a lot of hospital policy. It's a lot of, we have deadlines on these things. We have all these contingencies and reasons why we do this and that and this and that. After 26 hours, I don't know where I would be. You know what I mean? I don't know, and I don't know the details about your birth experience there, but it's like, sometimes it's kind of like, thank goodness, we have this option. But have you ever seen somebody who has come back and wanted a VBAC after a traumatic birth experience, or maybe just more generally, have you worked with women who've come to you after any kind of traumatic birth experience?
I have had women, I've had a lot of women recently too that are, working on a VBAC, and it's been amazing. As far as the traumatic birth experience, I haven't had too many that, have had, extremely traumatic. I mean, birth itself can be traumatic for anybody, right. But, there was not a lot of forcefulness or anything like that where somebody was not wanting to do it. And, thankfully, but I have had several and that were kind of coerced a little bit, and it's hard when you're been in labor for 24 plus hours to mentally make a decision and a choice when you're just exhausted and, in pain, and, sometimes you just kind of give up. And a lot of those women feel defeated and, they don't feel empowered because they let that decision-making process go more, because they were just exhausted and they were listening to what their provider told them. And not that was the wrong decision at all. I mean, I kind of felt the same way, and I believe that the decision that I made to have the C-section was the right decision. Although I don't feel that I really got the choice in the decision. And that was the frustrating part, because he was more like, we have to do this, and sometimes that is necessary, but, so thankfully I have not had too many, traumatic experiences where people come afterwards, but I have had a lot of people that are like, I want to do a VBAC, and they do get a little pushback. I know I got a little pushback as well. Where it was like, why would you want to do that? Like, let's just schedule another C-section. And I'm like, have you ever recovered from one? Do you know the benefits of having a natural delivery? So there is a lot of pushback just because it's more convenient to just schedule a C-section and know when that baby's coming and know your schedule and that kind of stuff.
Yeah. And I guess that's where what I was saying earlier, like more of the direction that I was talking about, are these unnecessary medical interventions or these unnecessarily planned C-sections and inductions. I recently had a mom who was pregnant who was feeling, I guess coerced is the best word, kind of like urged to have this induction because of her, the way the dates were lining up. And she was just like texting me like, do you know anything that I can like I will do anything to get this labor going. Like, what can I do? And it's just those kinds of things that I even believe, and I don't have the research. This is just this is hunch, this is maternal wisdom. I don't really know, but it's like, even just that, what that does to somebody's nervous system, how unregulated you become when you suddenly have to have this baby on a schedule, or you're like afraid of having to be induced or have, this serious abdominal surgery to remove your baby when it's the furthest thing from what you want, versus being in this extenuating circumstance where it's like, hey, if we don't do this, we will possibly not have a good outcome for you or the baby, and I think that's something every mother can get behind. But these more elective medical interventions are what I would like to see decrease, because then they also come with a plethora of issues after, even something as simple as my baby's not sleeping through the night. I was also one of those people are going to hate me by the end of this, who my kids slept through the night. I think my son had some belly issues, for a little bit, but once we got that figured out, they slept. They slept, and we don't realize how all of this stuff is connected. So, I hope you guys hear my heart talking here. This isn't like, Becca's on here just talking about her amazing experiences. Like, I put a lot of, it only happened. It's all on God, number one, but I had so many incredible women like yourself teaching me these things that I could do. And I was like all into it, which is why 11 years later, I'm still talking about it. I can't not talk about it, because it blows my mind that we know what, I don't know, the Kardashians are doing today, but we don't understand how. And when I say a traumatic birth experience, I'm talking for the nervous system itself is going to affect your baby, or when the mother gets injected with a particular kind of medicine, that affects your baby.
Right.
When you eat certain foods, this is a more common one, and you're breastfeeding, that affects your baby, and we have to have the awareness and then the discipline to kind of walk all this stuff out. But it really does start with just the education, because I don't think it's, it's not out there. So what else did you have? I think we were going to talk about
well, just to touch base on what you just said, and you talk about God, I believe, we all have this innate intelligence inside of us, that came from God. When you're pregnant, you're not saying, okay, baby, it's time to form your heart. Okay, let's get those lungs, your body is doing that, For me, I'm like, that right there is a miracle. That right there is showing there is a God that exists, because I have no idea how that happened. So it knows when it's ready to, come into this world. And as you talk about medical intervention, now we have ultrasounds. I think ultrasounds are done too often, some of it just because we want to see this 3D face of our baby before it's born, so we know what it looks like, but now they're guesstimating, well, your baby's going to be 8 pounds. We need to, have it a week early, so we're going to induce you. Every single mom who has done that, their baby has been at least a pound less than what at least my experience with my patients that come in, that baby was always a pound less than what they were saying. And they're not ready. Their body's not ready. And it's a traumatic experience when you're forcing labor onto a mom and a baby when the baby's not ready. They know when they're ready. I had a pregnant mom coming in this year that she's like, I'm late. Every child, she had several children, and she's late all the time, 41, 42 weeks. If she was not doing a home birth, she would have been having every baby induced, and I just feel like we need to, as moms too, and that's the one thing I try to at least teach my patients, is just fight for what you want, But from the medical standpoint, just with, I'm sure it's protocol because of malpractice. We don't want to deliver a 12-pound baby or, because there's more risk. So they're just trying to, cover themselves for anything bad happening too. So I get why they're wanting to push those things on, but I also feel like as moms, we just need to trust our gut instinct and, push for what we really want to do.
Yeah, which again, starts with having information and resources and a support system that will back you to feeling confident enough, when you do go into a care provider and when you ask for something. And, thanks for bringing up that, just like the baby being formed, in the womb. And this really is the intention of this project, is to keep birth sacred. Whatever it is that you want, whatever the right choices are for your family, it's this start to finish thing of understanding that, birth is miraculous. And it really does blow my mind how novelty it has become, because we're so focused on the baby shower and the colors and the ultrasound boutiques that have been popping up, and all of the mommy and me, we're ordering all of this stuff that's monogrammed and whatever. And it's like, I want to make it cool to spend like half as much time researching the crib and the paint colors and everything else we do. Like, if you just spent half that amount of time researching your options so that you could have this extremely empowering pregnancy, birth, and postpartum period, like, those are the moments that need to be savored. Those are the moments that need to be kept sacred. You planning for, if you have a career or if you're working, like, how are you going to manage all of this in a way that's as stress-free as possible so that you're not, anxious through most of your postpartum period, like whatever, right? Just how do we maintain the sacredness of this moment that we've totally made just like a transaction? And that's what really, I will use the word disgusts me. It disgusts me that we have made birth so transactional when it is literally a miracle. Like, it is such a miracle. Every mother, every baby, like, it is just a miracle. And the fact that, we just like put it on the calendar and go in and come back out, and now you've got this unsupported mom and this baby who's maybe in the NICU, and these parents are unsupported. And that's not everybody's story. I know I'm on the negative side of the spectrum, but those experiences aren't talked about enough, because we want to pretend that it's all like pink or blue, gender reveal, like there's more to it. And I see that through the work that I do in women who are still recovering from those moments, like years and years later. So I'll get off my soapbox now. This is your interview. Yeah.
You had mentioned it there about stress, and that's a big one that I like to talk about too, is prenatal stress. It's so huge. And I mean, we have so many things going on in the world that everybody's stressing about. And like you said, people are stressing now about gender reveals and, colors of the rooms. And those are things that we really shouldn't worry about. I mean, they could be fun things and stuff like that, but I feel like everybody's stressing and trying to make sure that they do all the things. But prenatal stress can actually decrease blood flow to the uterus, which can cause premature contractions, which is not good. It will also increase methylation. So you're going to be burning through the methylation process quicker, which is not always a good thing either. And as I mentioned before, how getting adjusted can help have the brain and the body talk together. The brain is what is really going to help control your stress. And there was a study done that showed that the chiropractic adjustment will actually increase prefrontal cortex activity, which is your executive functioning, your rational thinking. So when you're in that state, it actually turns off that stress and that fear state. So getting adjusted can actually help with that prenatal stress too. But I also recommend to patients to do things like meditation, yoga, deep breathing exercises, singing, laughing. All of those things help increase the parasympathetic nervous system, which is your calming, relaxing nervous system, and will help with stress, because, everybody is just, nowadays everybody's in this stressed out state, and it's very concerning, especially when they're pregnant.
And then what about, there were a couple other things you mentioned that about, maybe was it preeclampsia?
Yes, so it's a big thing that we see a lot of now is preeclampsia, which a lot is high blood pressure. So you have all these moms that are getting their blood pressure taken, and some of them are like, oh, I'm borderline preeclampsia. But you have to watch their blood pressure, of course, but blood pressure is going up for several reasons sometimes. It's not like a full-blown preeclampsia, but they're just, that one, the stress can help increased blood pressure, which is not good. But there is this, and I don't know, let me see if I can get this, if you can see it. So this is all my fun stuff that I like to do in my spare time. But this is the arginine cycle. So I don't think you can see it on here, but arginine, most of it will go to make creatine, and creatine helps build your muscles. Well, you're building a baby inside of you, with muscles, bones, ligaments, organs, all of that. So you're going to need more creatine. So your body needs creatine. You need more for your baby because it needs creatine. So arginine is going to go more over to make creatine so you can help form that baby. But one of the things that arginine also does, it goes to different pathways. It'll help fight infection. It goes to an endothelial pathway, which actually helps regulate blood pressure. And then there's another one that helps with the nerves. So when you're actually trying to get more of the creatine, your blood pressure is going to go up because that endothelial pathway is going, not all of the arginine is going that way. So a lot of times supplementing with creatine, so you don't have to make as much, or supplementing with arginine can actually help bring that blood pressure down for moms who have preeclampsia.
Interesting. So looking at, all of the options all of the common options for the cause versus just treating how things are presenting.
And preeclampsia now is another reason for, induction. We're going to induce you early because your blood pressure is high. Or we're going to do a C-section because we don't want you going through, your blood pressure is obviously going to go up when you're in labor. So they don't want the blood pressure going up in labor. So they do a C-section. So if, getting that blood pressure down by natural ways can help prevent any kind of medical intervention in the future.
Right. Very interesting. What else do you have?
Well, there's a lot of different things, but another thing that I recommend is choline. They found that 70% of pregnant moms are deficient in choline. And choline is important in maintaining the structure of the cell membrane. So, what goes in and out of that cell, it's super important in that role. It also helps modulate the HPA axis, which is your stress axis. So having choline on board will actually help with stress. And then it helps with sensory regulation, and it actually improves memory. So with the estimated 70% of pregnant women being deficient in choline, I usually recommend all of my pregnant moms take choline. It's very beneficial. It's something that I take too because I've realized through some other things that I was deficient as well.
Yeah. Now, is there some kind of test that you order or a chiropractor orders?
So I don't order any testing. I usually just, there are tests that you could do. I do order testing. I don't usually test for choline. I usually just recommend them taking it because, most of the time we're not getting enough choline from our diet. But a good source of it is egg yolks. There is a high concentration of choline in egg yolks. So sometimes if patients aren't too bad, then I will recommend just, hey, eat 2 eggs every morning. So
yeah, interesting. I didn't know that one. Did you have anything else planned for today? Any other notes there?
Not particularly.
Trying to think of some questions that I might have for someone. Can you talk through, and this might be hard, because you're having to talk through it, but if somebody is listening to this and they're pregnant and they're like, I'm on the fence about finding a chiropractor to go see, could you explain what a typical adjustment is and how, just to take some of the pressure off of how gentle it really is? It's not I feel like the movies ruin everything, make it everything's cracking and awful,
Now, this is my pregnancy pillow. So there's a big hole right here in the center, and we lay that on the table, and then mom lays on her stomach with her belly goes in that hole, so the belly's not touching anything. And then I evaluate and check to see what needs adjusted. Mainly, as far as the Webster goes, we're looking for the sacrum to see if it has moved at all. And then I use the drop pieces. That way it keeps their body in line, because if you've ever been to a chiropractor before and they put you on their side, you're gonna twist the body some, and that's not necessarily good to do when you're pregnant. So I just keep them straight, use the drop pieces. It's very gentle. And then, there's different aspects to the Webster technique where we also check the piriformis muscles to release them. We release the sacrotuberous ligament, which is just a little contact, just a little bit of pressure on the buttock area, which is where the sacrotuberous ligament is. And then I check the psoas muscle, which attaches from the lumbar spine to the hips. And that is where my son, he laid on my psoas muscle. So getting those in proper, getting them so they're not too tight or too loose, that helps keep everything in alignment, but it also helps, so the baby's not, because that was some of the worst pain I ever had was when he laid right on my psoas muscle. And then the pubic bones, I, check those just because that's part of the pelvis as well, and they can shift and move, and that can cause a lot of pelvic pain for women. And then I also check the round ligament. So it's just a whole process of the Webster technique. It's all very gentle. Mm-hmm. It's not a lot of popping, cracking, snapping, none of that.
Yeah.
I see those videos and I cringe every time I see those videos. But I mean, there is sometimes that is involved, but not what I just use the drop pieces with my pregnant moms. So it's very low force. The table itself can be a little loud, but it's very low force and very comfortable for the mom.
And then would you recommend any at-home movements? Or I think it was you that told me, because at the time I was doing a lot of work from home, pre-COVID when it was cool and everyone was doing it. But I think it was you that told me, instead of, sitting on a normal chair, to be on an exercise ball. So just things like that I never would have thought I would imagine it was you. I don't know how else, but so I got this exercise ball and I would sit and work on it and just rolling out my, you kind of do it subconscious, you're not really thinking about it, but instead of sitting on this hard chair all day, doing something like that, is there anything else you would recommend, or how to lay for sleeping, or stretches or anything like that for?
Well, it's funny you say that, because I'm sitting on an exercise ball right now. I have my hair.
Then it was you. Caught you red-handed.
I just think it allows, it keeps you in a better posture, but you don't have that compression either. You have a little bit of give. So I just feel that it's better. I do recommend stretches for the piriformis muscle. We call it baby in the basket. I don't know. If you take your leg up like this and put it across, and then it's your belly would be the baby here, goes in the basket. Here's your basket right here. And that helps stretch that piriformis muscle, which usually gets tight during pregnancy. And it also lays over top of the sciatic nerve. So a lot of women experience sciatica when they're pregnant. And this works for anybody with sciatica or pain like that, but that will help stretch that muscle. So I usually recommend that to all of my pregnant moms. And then what was the other one I was going to? Just your normal stuff where, which I would recommend to anybody. A good pair of shoes. I don't recommend heels at all. A good tennis shoe with lots of support. Memory foam inserts are the best, because that allows you a little bit of shock absorption. But when you have your posture is already, because your weight distribution is different, your posture is already going to be changing. When you put heels on, it pushes you forward, and it's going to cause you even more lower back pain, because you're going to compensate and try to arch your back, and it's just not good. So I recommend a good pair of shoes, and just to try to change positions. Don't sit for extremely long periods or stand for long periods. Do a combination of sitting, standing, walking, just so you're moving.
That's good. And the movement even during labor is very, very helpful, which can sometimes inadvertently be restricted based off of your situation, whatever you have going on. So, we might end up having to do another one of these at some point, because it just goes by so fast. But the last question I want to ask you is, as a mother and as a chiropractor and as somebody who has had a cesarean section and a VBAC and an almost 21-year-old, which is just insane, what is something that, is there something you can think of that you wish you knew, or like the most important thing, not even specific to chiropractic care, but just as a mom, like mom to mom, what would you want? What do you wish you knew? What would you tell somebody who is coming to you as a first time mom, or even like for your boys, when they maybe one day decide to have a family, like what would you want them to know that's like the most important thing? I know this is
Well, there's a couple, but first and foremost, I wish I would have known about the Webster technique prior to getting pregnant, because I really believe if I would have been getting adjusted throughout my pregnancy with the Webster technique with my oldest son, that it's possible that I would have not had to have a C-section. No way of knowing that for sure, but for me, I wish I would have known that. Secondly, with him, how I mentioned he didn't sleep. Another reason I didn't find out until he was probably 12 years old. The reason that he didn't sleep, he was nursing all night long. Like he literally nursed every hour to hour and a half. And I found out it's because he had a tongue tie. But I didn't find that out till he was 12. So I have been doing a lot more with that. Like when I check infants in my office is something that I look at, and I don't diagnose it, but I do refer them out to a dentist that I know she does diagnose, and she does revision. So I wish I would have known more about that then, because the difference between the two boys, that when I was nursing them, the one with the tongue tie was miserable. I understand why people gave up on nursing.
Totally.
Because it was so painful. It was miserable. I was doing it every hour, and I was up all night. Like it just was exhausting. And I did not give up though, but I understand completely how people do. Where the second one, I was like, I think something's wrong, because I didn't even know I'm like, what is he doing? Like he's not doing anything. And I was able to produce a lot more milk. It was easy. It was simple. He slept all night. He nursed every 3 to 4 hours. Like, so the difference in that, the tongue tie versus no tongue tie is huge. So, and it is thankfully being more talked about. Like we're hearing more about it, and people are diagnosing it, but I've also had a lot of people where I send them out and they don't go to who I want them to go to for insurance reasons or whatever. And I get, oh, well, they said it wasn't bad, but I come from the aspect of, my mentor always says, you're not just a little bit pregnant. You either have a tie or you don't have a tie. You're either pregnant or you're not, so I feel like it's going to benefit them in the long run to have that revision. That was completely off topic.
No, that's
but it's
good.
Really
anything else?
Important. It will help so many new moms.
Yeah. And then anything from just like a total family standpoint, like, because I often think that, I would like to think that that by the time Arlen and Eva are of age, to have children, if they choose to have a family and all this stuff, that, they can look back and see all of this. And I'm a huge advocate for the men, and the dads as much as the women. So, I mean, you're a mom of boys. Is there anything that you would tell them that's like just an insight after all of your experience?
My oldest one, I don't have to tell this because I always say I want to be him when I grow up.
Oh.
But the stress, especially as moms, but we see a lot I see it a lot in men too. We just stress over, whether it be finances, our kids, our, what our job, our friendships. We're torn in so many different ways nowadays. And I believe that social media has amplified that stress because, you see these picture perfect lives on social media, right, and they're not necessarily real life. True. Those things are happening, but we're only showing the best parts of our lives. Really to just try to, find ways to not worry and stress. My oldest son is that kid. He just doesn't go with the flow, doesn't worry about a thing. And that I wish I was always a worrier. I worried about my grades, about, friendships, about, just everything, then work, then kids. And I've learned, through the years that, and it's more, for me, it's been more my faith in God that I've gotten rid of that stress and I just trust in Him. But, that's a huge one for most people that I see that's been the struggle.
Yeah. Well, thank you so much. I'm so glad we got to do this today. I know it's going to help people.
Thank you for having me.
Yeah, and if you guys want to connect with Michelle, I'll have all the details below. Thank you so much, guys. We'll see you in the next episode. Bye.